Public libraries have always been about wellbeing. When Victorian Scottish philanthropist Andrew Carnegie gifted libraries to towns and cities across Scotland, he very much had wellbeing at the forefront of his thinking. By allowing access to reading and books, he envisaged self-improvement, better employment opportunity, and consequently a route out of poverty to a better standard of living. What we know today as wellbeing. So, more than 100 years later, it should be no surprise, a collective force for health and wellbeing has come about. This initiative builds on the strong public library network of over 500 venues, stretching from Shetland to the borders. And local library services remain the most popular service which local government provides, with a pre-pandemic footfall of over 40 million. Now, to make this real for you, that is more people visiting local libraries than attending Scottish Premier League football matches. And these libraries are trusted, safe spaces and are very much valued in the local community.
My name's Gregor Smith and I'm the Chief Medical Officer for Scotland. Scottish libraries are a tremendous resource to the country, a real asset to the nation. Their unique position within communities allows them to act as a trusted source of information, and that's why that role in supporting communities is so important in promoting health and well-being.
So, here we are at Port Glasgow Library in Inverclyde to talk to Ali and Nolan and her team about the health and wellbeing initiatives that form part of the collective force.
In Inverclyde, we have been working very hard pre-COVID and post-COVID on lots of initiatives to support the local community, and part of that has been developing a strategic a Health and Wellbeing Action Plan, and part of that is really building on the relationships that we had, put in place pre-pandemic and seeing where we can go from that, and working together to co-design kind of programs, services, resources that would suit the community.
So it started in 2018 with our Chatty Cafe Crafters in South West Library, and really it's just to bring people together. We now have 5 Chatty Cafes, they're all themed, from Chatty Crafters, where people get together to knit, craft. We've got a gardening Chatty Cafe, they come together to just share tips and hints about gardening and just chat, blether. Also a beading one with 2 climate focused Chatty Cafes which were developed last year in response to COP26 in our climate beacon status. So the main thing is they get together and speak, a blether and a cup of tea, biscuits, very important.
These lovely ladies, part of the service, had been giving out hearing aid batteries for us during COVID, and it's been immensely vital for our deaf and hard of hearing patients. They can just come in themselves or with their or relatives, pick up batteries as long as they have their own kind of record book to prove they're entitled to the batteries, and it's been great. Honestly, it's this hearing aid batteries service has taken a huge weight off us, because it means we can now tailor our needs into more patients that can, have to come to the hospital settings. I think it's great taking that pressure off NHS health services. We took the decision to extend Books and Wheels. So previously you had to be literally housebound before you could access the service, but we opened that up to just anyone who felt as though they could benefit from having library books delivered to them. What we decided to do was to involve them in not chatty cafes, but make their experience more like a chatty cafe. So for example, there was a project called Inverkind. So the Inverkind project allowed us to put just a tea bag, a biscuit, a wee message into each delivery that we were sending out, so that these people were then included as part of our library community. The feedback was tremendous.
We got our young people involved, so again we've moved our library club online. So what we did was we got the library club to write messages to the extended Books on Wheels customers. So we got a lovely bit of intergenerational, community spirit going, which lifted, I think, a lot of people who had felt incredibly isolated. And another thing here in Port Glasgow that we do is we have a Macmillan hub.
So there's 2 strands to it. There's the Macmillan, the volunteer drop-in centre, one-to-one sessions to help people alleviate some of their concerns around cancer diagnosis. But within Inverclyde there's also a Macmillan funded welfare rights officer. So we were able to work closely with her to provide practical welfare advice and help to people who had a cancer diagnosis. And again, the feedback from that has been really, really overwhelming. It's a safe environment, it's convenient for people, and it just does exactly what Macmillan aims to do. We've had people come to Macmillan drop-in, knowing about a chatty cafe and transferring from one to the other.
Every need is an opportunity, and our customers are so important to us. We've always moved forward rather than stepping backwards, but I think the secret to that is really designing with our partners and bringing our staff with us. Collective force is important because it gives us direction to what we are trying to plan for our libraries in supporting, health and well-being in the community. I heard this wonderful quote, and I think it rings really true for libraries, is, if you can improve the health of one person, that's really good, but if you can improve the health of a community, that's amazing. And I think that's what libraries can do.
Libraries are not just about books. For those that still have that stereotypical image of a library as a place for books and reading, when you realise, hang on, it's not just about books.
I suppose to say, libraries are the great leveller. Everybody's welcome in a library, everybody's welcome. We offer traditionally and always trusted information. So, and especially in this day and age, as well, you're going to get what you need within a library. We are at the heart of the community, therefore we can support people, in their daily, recovery from COVID, shall we say.
It's been a real pleasure for me to work with the Scottish Libraries and Information Council over the last few years to develop our shared aim of trying to promote health and well-being in these communities, using realistic medicine as a mechanism by which we can do so that we can support people to have conversations with their clinicians that mean more to them, and that means that their aims and objectives in their own health and well-being are being met.
A collective force celebrates and shares the good practice and innovation taking place in many parts of Scotland and enables it to be scaled up to national level. The Health Wellbeing Action Plan has been delivered in collaboration with the Alliance, the Digital Health and Care Innovation Centre, DHI, the Scottish Government Self-Management and Health Literacy Team, Public Health Scotland, NHS 24, COSLA and NHS Education Scotland. And they all support its implementation with SLIC. So Chris, can you tell us a little bit about what is ALICE and how maybe that relates to the collective force?
Yeah, ALICE is a local information system for Scotland, and it's an online resource for people to find and share information. The reason that we're interested in the Collective Force project is because we think that there's a very good fit between what ALICE does and libraries.
A collective force for health and well-being will establish libraries as the go-to places in communities for trusted health and well-being information in digital and face-to-face. Digital, information and health literacy skills and access, facilitated reading and storytelling for personal growth and therapeutic support, and social interaction and empathic help and support, both face-to-face and digital.
We're here in Bishopbriggs Library. I've lived in Bishopbriggs about 12 years, and I've been working at the Alliance for about a year. Before I joined, I looked up ALICE, put my postcode in, and I found things on there I didn't know existed. One of the interesting things about where we are in Bishopbriggs, we're just into East Dunbartonshire, but what ALICE allows you to do is pick up local resources, and it doesn't really matter whether they're in Glasgow or whether they're in East Dunbartonshire. So you can see the local food bank, you can see other things, the dementia cafe that's not far away. And as I say, things that you wouldn't necessarily find out about. They don't have a big profile online. Their social media is maybe non-existent, but it's just a group of people who are interested in whatever that activity is. I think that's one of the really good things about Alice, is it allows you to uncover these little gems. The collective force is centred around libraries and that notion of health and wellbeing. And as an organisation, the Alliance is very much in that space. We're keen to promote people with long-term conditions self-managing those conditions. Through Alice, they can find resources that will help them. Libraries are really important because they're a focal point within communities. So they have the devices, they have the internet connection, they have the staff who can support people, whether it's directly to access things like Alice, or just supporting somebody, giving them a bit of coaching perhaps to get online and to get where they need to go.
A collective force will support the movement to a health and wellbeing service model, co-designed with citizens with a focus on self-management and preventing ill health. In 2022, we see the new plan being launched by the partnership, celebrating the work which has already taken place, shining a light on the transformational outputs from the partnership, and scaling up of the initiatives so people, wherever they live in Scotland, can access information to improve their own health conditions through the local library service.
I would describe the Collective Force for Wellbeing as a strategic aim to get libraries, NHS, third sector and partners to work together for the wellbeing of their communities. North Ayrshire Libraries have worked with the NHS Ayrshire for a number of years. It was identified that a lot of health professionals weren't aware of what libraries could do to support health and wellbeing in their communities. We got the Public Library Improvement Fund to look at how we could develop promotional materials. Since then we got further funding and we were able to invest in the Reading Well books for dementia, mental health and wellbeing and long-term conditions. And these are tried and tested books and resources for people with various conditions. We're not health experts, so it's good to have the tried and tested books for people to use. We have many health groups in libraries. We engaged with dietitians, we engaged with physiotherapists, we engaged with speech and language therapists, and some of them started running their clinics in local libraries because it was seen as a more neutral, sort of less judgmental space. Nobody knows what you're coming into a library for. You could be in here to get a book out just for reading for pleasure, or you be coming for information about a holiday or information about a health complaint. And now that the library staff have had training, information for wellbeing training, our most recent training, then they're better equipped to deal with inquiries that come across the counter. Because quite often people ask for something, but it takes inquiry skills of a library member of staff to actually find out what it is they're really wanting. And they maybe don't get that elsewhere. And again, it's at that neutral space in your local community and accessible to all. So that's why we think libraries are key. You don't have to be a member of the library to walk through the door. So you can access a lot of our services without actually having to be a member of the library. We have free Wi-Fi, we've got PCs, we've got printing facilities, which people can use as well without necessarily being a member. And I think people trust us. And I think that's very key in this day and age. We're rebuilding our library services here in North Ayrshire, and just lovely seeing people come back. We always go above and beyond to try and get an answer for somebody. We've never passed somebody on to another organisation. We'd make sure that it was the right organisation and the right contact. The idea would be that every library would take a collective force for wellbeing and tailor it to suit the needs of that library. Because every community is different, every library building is different, every idea is different, and it's just trying to see what fits there, because the library staff have got the autonomy, the training, the information for wellbeing training will be rolled out. So there's a real, I suppose, perfect storm come together.
Bibliotherapy Words for Wellbeing are a similar two branches of the same tree, if you will. So it's basically where words you know, and that could be songs, that could be poem lyrics, that could be non-fiction, it could be news articles. Over the past couple of years, our bibliotherapist has used TED Talks, anything that kind of stimulates a little bit of just kind of thoughts, feelings, emotions, anything within people, that bit of a sort of a creative outlet to then help them deal with some of the challenges that they have in their own lives and maybe see something with a slightly different perspective, or just view things in a slightly different way. The skill of the bibliotherapist as the facilitator for that session is making sure that then if somebody, you know, in that where somebody wants to speak, or whether actually somebody, you know, maybe something has hit home a little bit, and just to kind of give them that space to sort of think and then reflect about what they've been reading and how it's made them feel. It's a person-centred approach where groups are facilitated by our bibliotherapist, and a range of texts, whether that could be song lyrics, that could be non-fiction, also pictures. In the last couple of months, or years rather, we've been using TED Talks as well, all kinds of things to kind of stimulate a reaction from people. Having the sessions in libraries, I think, is a very safe and neutral space, and although that hasn't been able to happen over the past couple of years, the sessions have been on Zoom, and I think it's been a bit of a challenge, but also a bit of a gift, and being able to kind of curate a slightly different session with not having the people face to face. But I think that's just testament to the skills of Juliet, our bibliotherapist, for being able to kind of get that out of people. But once people have experienced a session, have gone through a session, I think that they can very quickly see the positive benefits of the actual what they're doing with the spoken word, as well as being in a group with kind of people who are maybe who are maybe in similar situations to them. We have a carers group, for example, so those people all have that commonality of the experience that they have, and then how that impacts upon their life. The impact has been very positive, and participants generally feel that it has a very positive impact on their mental health and just on their general sort of health and well-being.
These library initiatives have been inspirational, making real positive changes to people's lives. If you haven't visited your local library recently, do one great thing for yourself. Start your health and well-being journey at your local library. Scotland has over 500 libraries to choose from. Join yours.